Good evening, everybody, and thank you for joining us this meeting of the Children's Overview and Scrutiny Committee. Can everybody hear me okay? Marvellous. Right, so I will start by asking Louise to read the housekeeping notice, please.
Thank you, Chair. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chair. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point in front of the front car park of this building. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. For those in the room, this includes turning off microphones and turning down the volume on your laptops completely. Thank you.
Thank you, Louise. And still with you, do we have any apologies for this evening?
Yes, Chair. We've received apologies from Councillor Simon Ball, who is being substituted this evening by Councillor Sarah Armstrong.
Thank you very much. And I'm now looking at the committee for any declarations of interest that are relevant to this evening's agenda. Sarah.
Thank you, Chair. Just to declare that I work for an alternative education provider that also delivers services to children who have educational healthcare needs. So I will leave the meeting at that part of the agenda.
Thank you very much, Sarah.
I think I should declare that I have a very close family member in receipt of EHCP and alternative provision.
Any other declarations of interest, Oliver?
Yeah, I've got a partner working for Dorset Cows.
Thank you very much. I think that's covered everybody. Brilliant. So moving on to the minutes. Unless anybody tells me otherwise, can I have these accepted as a true record of our meeting on the 10th of June, please? Do we have any comments or questions attached? No? Thank you. We all happy with those? We agree. Thank you very much. I will sign them later in that case. Marvellous. So moving on, we have the action sheet. And again, unless anyone indicates otherwise, I'm proposing that we remove the items that are highlighted in yellow with the reasons that are given, and to note the remaining outstanding actions which track decisions, actions and outcomes arising from the previous committee meetings. Does anybody have any comments on that proposal? Are we happy to agree? Thank you very much. Okay, so that will be done. That takes us to public issues. And Louise, do we have any public issues for this meeting?
Yes, Chair. We've received 2 questions and a statement from Mr. Sofianos.
Thank you very much. In that case, I invite Mr. Sofianos to come up. Please do. And Adam, if you would just ask your question, then Richard will reply each time and then just move on. Doesn't need to come back through me each time, as it were. And if anybody else has any questions or any comments at any point along that, just do let me know. Thank you.
Thank you, Chair. Good evening, everyone. My first question relates to Agenda Item 9, Alternative Provision Improvement Plan. The data provided in the paper is alarming. 1,372 children are accessing alternative provision, a headcount larger than all but 4 schools in BCP. 95% of these have SEN. 15% have been in alternative provision for 3 or more years. Equally critical is the experience of children during placement. At November 2024's meeting, I requested some data on this, but was told it would be provided at a later meeting. 10 months later, I'm not aware of a full response. So, What is the current overall rate for APs within BCP for 1. Sessions missed, 2. Pupil distance travelled, 3. The proportion of pupils allocated places within 6 school days of exclusion as required by law, and of the current alternative provision placements, what proportion is being fulfilled through an online provision? Thank you.
Thank you, as always, Adam, for your question. So I'll break down the answers into parts and deal with them one at a time. So the first one, attendance. We are currently implementing a system for capturing the attendance of children and young people who are placed in unregistered provision and not on a school roll. Attendance for state-funded alternative provision schools in 24-25 academic year are the Christchurch Learning Centre, 50.38%, the Key School, 64.30%. The national average for interest is 41.70%. That is the latest published from the DFE, which was the 2022-2023 data. Pupil distance travelled. Some providers offer provision in different locations, so we are not able to currently report on this. The proportion of pupils allocated places within 6 school days of exclusions as required by law. Of the 108 children and young people that went on to alternative provision in the 2024-25 academic year, 48%, which is 52 children and young people, were allocated places within 6 school days of the exclusion. This is a figure that we are not happy with, and we are addressing this through our service improvements. And of the current AP placements, what proportion is being fulfilled on online providers? We aren't able to currently report on this due to some providers offering online and face-to-face provision or a mixture of the two. We are setting up methods of how we can capture this going forward and aiming to implement this by October half term.
Thank you, Councillor. Question 2 is against agenda item 8, which is the SEND improvement update. The outlook for SEND is grim. Costs continue to rise well above the government's appetite for funding. Service delivery fluctuates. Yet the need among our children is undeniable. Last year in BCP, 97% of needs assessments resulted in a plan. Nationally, over 98% of tribunal hearings end in a win for families. With mounting political pressure to reduce children's rights, there's the potential for catastrophe. And far from reducing costs, this could turbocharge them. Across both the SEND and the AP papers and in national studies, we see one of the key drivers that overall, schools and policies are not inclusive enough. But by securing more supportive cultures within schools, the Council could provide some resilience against any future attack on children's rights. So, how is the Council addressing this? And in particular, what's happening with its inclusion strategy? Thank you.
Thank you again, Adam, for your thoughtful and passionate reflection on the current leadership of SAND. I share your concerns about the pressures facing the system and the importance of protecting the rights and futures of our children and young people. At BCP Council, we recognise that inclusive practice is not the responsibility of individual schools alone. It requires system leadership, shared accountability, and a culture of collaboration across education, health, care, and communities. Our approach is rooted in partnership and cooperation, and we are committed to working alongside schools rather than criticising them. I would like to emphasise that point, as my background means that I understand the pressures of working in schools. Working together always puts children and young people first. The Council's approach to inclusion is embedded through our belonging strategy, which is launched in June 2025. This strategy sets out our ambition for every child and young person to feel a sense of connection and belonging to their schools and community. It promotes inclusive values, the identification of need, and high quality provision across all settings. Our refreshed SEND improvement plan of 25-2027 is essential to this work. Developed with partners including parent carers forums, NHS Dorset ICB and education providers, the plan focuses on 8 priority areas including early identification and intervention, strengthening pathways to ensure children receive support before need escalates, inclusion, supporting schools to develop inclusive cultures and practice with targeted outreach and professional development, and communication and cooperation, ensuring families are active partners in sharing service and provision. We are also investing in system-wide support through initiatives such as the development of the 3-tier alternative provision model, aligned with national best practice, the creation of an education partnership board to provide strategic leadership and accountability, a renewed focus on trauma-informed and relation approaches, particularly for children with social, emotional and mental health needs. We agree that reducing children's rights would be both ethically and economically damaging. Instead, our strategy is to build resilience through the inclusive system, early support and strong relationships with schools, families and communities. We welcome continued dialogue and scrutiny, and we are committed to reporting regularly on progress and impact.
Thank you. Finally, a statement on agenda item 11, the annual report, and ending on good news, I hope. On the subject of compliments, I'd like to add mine for the incredible support given by officers to the Muddyford Wood Playgroup. As members will recall, the group was given notice to leave its previous premises and was weeks away from folding. Just before the summer, the council offered to reopen the vacant Highcliffe Day Centre and make accommodation for the group and its families there. Since then, a huge amount of work has been done to get the sites ready on time. I visited the playgroup team recently as they were putting the final touches together, and it looks amazing. This is a reminder that the council's portfolio of properties retains huge community value, and even vacant sites can solve so many challenges. And it's a great example of what can be done together, and I know how grateful everyone is. Thank you.
Thank you very much for that, Adam. And in fact, we echoed at our last meeting the gratitude of everyone for the work that was done to bring forward the Muddyford Wood, the relocation for that playgroup. So thank you for that. And given the items on our agenda, I'm sure that my fellow councillors will be picking up any of your points that if they feel they haven't been fully answered or need further fleshing out. And Adam, I'm sure you will be coming forward with any more questions if you feel that they haven't yet been fully answered. And I can only offer my apologies to you that the question from last November wasn't fully answered for you, as was planned. Okay. So moving on, we now have the update from Lily, our member of the Youth Parliament. And over to you, please, Lily, for your report. Thank you.
Thank you. So you may recall that in the previous ONS meeting, we shared that we're running a survey to collect young people's mental health experiences from school. We collated these responses into a script, and Ruth and I spent a day filming this at a CAMS training facility. After that, we then discussed our vision for the video and gave it over to the editor. We received a draft back from it recently that we reviewed with Nikita and Claire from the Mental Health in Schools team, and then we sent it back with our feedback. We're aiming to have it released by World Mental Health Day on the 10th of October, but before that we need to review the next draft and have it signed off. If this date isn't possible, then the next date possible would likely be the Children's Mental Health Week in the 9th to the 15th of February, and will act as our backup date for its launch. Before we launch it, we want to hold a webinar the day before, inviting relevant people to the campaign for a taster of the video and a Q&A. Elliot has been kind enough to produce a poster advertising this information. We're planning on having it at 5:30 for about 55 minutes. Ryan and I also attended UK Youth Parliament Annual Conference in Brighton in July. Hopefully you saw our updates that we posted on BCP Council socials. Ryan has been working on his knife crime campaign since the last Children's Service Overview and Scrutiny meeting. He's worked on the following: a school rugby and knife crime prevention event. In June, he made a decision to postpone the event at bringing schools and police as well as rugby together due to the lack of school sign up. We're working towards this now happening in the afternoon of the 1st of October at Merrick Park. We currently have 2 schools signed up, with others expressing interest, and we have confirmation of attendance from Dorset Crime Commissioner, Dorset Police, and the charity Changes Are Made. Confirmation on the plans for this event will be shared with the committee via email as soon as timings are confirmed. He's explored how to best support a pilot to bring local armed services together with young people to introduce martial arts and share knife crime education, and has asked the Police Crime Commissioner questions as part of a social media campaign to share responses back to young people based on past engagement with the Office of the Police Crime Commissioner. Elliot was recently appointed as the Southwest representative of the Youth Select Committee, and in this committee they are going to call ministers and organisations to create a report that is going straight to the government. The topic of the report is the topic in which Elliot has advocated for himself, which was standardising the PSHE curriculum to ensure that it's sufficient for all students, no matter the school. On this Wednesday, he travels to the House of Commons for an induction and to run for the chair of this committee. Ruth has campaigned on homelessness since last year and has been a member of the Night Stop Dorset board. Within this role, she championed for the voice of young people and ensured their views were represented in their future business planning. Ruth has led sessions of the BCP Youth Forum to help include her other viewpoints. And last week, Ruth moved to York to start university. She plans on keeping regular meetings online and attending Night Stop board meetings and support the launch of the mental health resource by virtually. Thank you. If there's any questions, please feel free to ask them.
Thank you very much, Lily. So first of all, I'd like to congratulate Ruth on successfully going to York University. I'm sure she'll have a wonderful time. It's a beautiful city. And I'm very, very glad to hear that she's going to continue working on the Night Stop board. I'm also on that board, and it's a great charity and it's great work that they do. And she really does add a lot to it. So that's really fantastic. And thank you for that update from the rest of you as well, on behalf of the rest of you. Are there any questions or comments from the committee? Peter.
Okay, thanks for that. Sounds really impressive. In terms of engagement with the schools, how's that going kind of across the conurbation in terms of numbers? I know it's a difficult
Is this
task.
for Ryan's campaign?
Yeah, not just generally really with the MYP and deputies sort of duties and how you kind of get about, how's that relationship kind of developing?
Well, for my campaign, we're planning on including the video into teachers' training. Okay. So it's less about the students thing because they've participated through the survey and they've given their responses quite widely. Quite a few people responded to that. But their part is sort of minimal now, as it's more up to the teachers on how they respond to the video that we've sent out. And then for Ryan's campaign, would you like?
Yes, absolutely.
Yes.
So it's gone out via the like school sports coordinator for Bournemouth and the others. There's one for Christchurch and one for Poole as well. We've had quite a lot of interest back. So about 6 schools have expressed an interest and 2 have signed up. There's schools that haven't always engaged with us around the sort of youth parliament agenda. So a couple that are new ones to us. So that's kind of promising. So that we've gone kind of down that route for that. In terms of like the next lot of elections, we're just starting to launch that, and already schools are making contacts. So yeah, good, I would say, responsive.
Okay. So at the last meeting, there was an action point based on a motion that went through about rebirthing youth services in relation to future funding. And I just wondered whether, I know you're really busy, you know, you guys, whether you could commit to working with us at some point to gathering the views of children and young people on how they may shape like a modern youth offer, no matter what, you know, say it could be a 10 quid, it could be 100,000, you never know. But we need to be ready for what young people feel they need as a youth offer. So it's an invitation really in your busy workload to see if you can sort of fit that in. If we just knock on your door and go, can you help us? We don't want adults making all the decisions on this.
That would be great. I'd like the offer. Thank you very much.
Thank
Emily.
you, Sharon. Thank you. Just a quick question. You were speaking there on the back of what Peter was asking about engaging with schools. Do you ever reach out to home ed communities or young people who are not in education? Is there any way of that conversation taking place?
For sending out for people joining Youth Parliament, I know that Becky offered. Yeah. You know more about it.
So in terms of the last Youth Parliament election, which obviously beginning of last year, that opportunity is advertised through their kind of networks. We've got a couple of young people who attend the forum and have one who's attended for the last 4 years who advocates it across their network. And in terms of voting, we promote it via the BCP website and that network to sort of say you can access codes this way. In the last month, I've had one inquiry from another young person who's joining the forum who's home educated. So it is getting out there. I don't think there's a specific, we send it here and it goes there regularly, but the messages, I think the media ambassador stuff that they're doing is and putting online is reaching a wide audience as well. So
yeah, that's awesome. Thank you.
Thank you. Dwayne.
Thank you. Yeah, a comment rather than a question. I'm new to this committee. I just want to say I'm really sort of impressed by all the work that you say you and your colleagues are doing on the Youth Parliament. I'm particularly impressed with what I heard about the knife prevention work. I've met Cameron's grandmother and his brother. I've been along to the boxing sessions, which as ward councillors we supported, and I just think that's really fantastic that get involved with that sort of thing. Young people who take an interest in issues that affect them and things sport or sort of art or dancing and things like that. I think is is kind of the way forward. More of that sort of thing is great, and if young people themselves, children, teenagers wanting to lead on that sort of thing, I think that's just brilliant, because it's good to. Sometimes you might think, well, that's a good idea to do that, to come up with something, but to actually get involved in some way and have an influence, and I'm just really impressed. That's all I wanted to say. Thank you.
Thank you.
Thank you for that. Are there any other questions or comments for Lily? Oh, I'm sorry, Ollie, over to you.
I think it's where I'm sat. Yeah, so the rugby tournament, is that going to be just men's rugby, or is it men's and women's rugby?
Yes, please. Sorry, I don't know much about Ryan's campaign, so I'm going
That's
to
all
pass
right,
it to
no
Becky.
worries.
So it's gone out to schools as an offer for year 8 and 9 students for their non-rugby team. So it's like, don't pick your first team. It's tag rugby or touch. They're kind of in discussion. Mixed teams are welcome. So it's kind of like more about bringing people together to play some games. We're hoping some of Dorset Police's rugby team will be present and be able to do some coaching. Oak Medians have put some staff in as well to help do some sort of, they're planning a big sort of warm up together and then into sort of small groups to put into practice what they've done. So it's not really about the competitive, professional level rugby. It's about it being open to different young people and showing them that there's alternatives to perhaps some of the other activities that aren't as positive.
Brilliant. Well, hopefully when the Red Roses win the Women's Rugby World Cup, the uptake will be even higher.
Yeah.
I'm sure they will. They've only got France to overcome now, haven't they? Thank you very much, Lily. Are there any more comments or questions? Okay, thank you. And do stay, and obviously any input that you have to any of the future items would be very welcome as well. So please do ask questions if you have them. So just before we move on to our items of business, I've got a couple of announcements I want to make. The first is, or a few even, the first is I forgot to do this and I'm so sorry. I meant to welcome Dwayne to the committee. I'm really sorry, I meant to do that right at the beginning. So thank you for joining us. That's really good to have you on board. Other than that, I need to let you know that with support from Democratic Services and Children's Services, the Children's Services Overview and Scrutiny Committee has begun the process of electing new parent governor representatives. As a result, today marks the final meeting for our current parent governor representative, Peter. And so on behalf of the committee, I would like to sincerely thank him for his valuable contributions, input and dedication to the work of this committee. His involvement has been greatly appreciated. I think it's 4 years, so that's quite a stint. And I'd also like to take this opportunity to share that I recently attended some SEND scrutiny training, where I learnt that it is considered good practice for this committee to have a representative from the Parent Carer Forum. And I would welcome the committee's views on this and hopefully have your agreement to progress that piece of work. So if anybody has any comments or questions on that. Emily.
Not much to say other than I think that's an excellent idea. Fully support it. I think having other people with different views and opinions only strengthens the discussions that we have and therefore the work we can do for the children and young people. So very happy to support.
I think it's envisaged that they would be invited to the relevant meetings. They would not be a permanent member of the committee, but we can discuss that. And if anybody has any ideas for any other groups that they feel should be represented on this committee that currently aren't or could attend on that sort of ad hoc basis, then please do let me know. Thank you. Sandra.
Yes, I'd like to include SEND-IS in that, please.
Yep, we can certainly add that to the piece of work. Thank you very much. Marvellous. In that case, items of business. The first item, substantive item this evening, is the Children and Young People's Mental Health Transformation Update. This is an update from just under 2 years ago, I think it was. But I'm sure I'll be correct. No, everyone's nodding. That's fantastic. What a great start. So I can see that online we've got Suzanne Green, Claire Young and Helen Duncan-Jordan from the NHS Mental Health Programme. And so I'm going to invite, I think we're going to start with Helen. So I'll thank them all for coming. And over to you, Helen. And at the moment, we are recommended to note this report, but let's see where the debate takes us.
Thank you, Chair. Thank you, Committee. Thank you, colleagues. You're right, it was getting on for just over 2 years, I think it was, that myself and the then Principal Programme Lead for Children's Mental Health, Elaine Hurl, came to talk to you at the start of the transformation programme that we were just about to embark on. So it's a real privilege for myself and Susie and Claire to come and report on our journey and where we've got to at the end of that of the piece of work that we've been doing. So it really is quite an exciting time for us at the moment. I'm aware that the report that you've got in front of you is probably a bit light. So what I want to try and do is to pull out really some of the work that we've been doing and to set that in the context of, I guess, a picture of increasing prevalence of mental ill health in our children and young people that's really been happening over the last 10 to 15 years. I think it's fair to say that probably in 8 years ago, in 2017, we would say that there was about 1 in 10, children and young people would say that they were reporting ill mental health, and that's probably increased in 2023 to about 1 in 5 8 to 25-year-olds would say that their mental health is poor. So we've seen this increasing picture, really sharp rise, and obviously in the middle of that we've had COVID. I'm not going to get into the reasons why we think that that might be happening, because they are many and varied, and probably would take most of the evening for us to kind of debate some of that stuff. But it really was something that from a governmental perspective, in 2017, the then government brought together a green paper looking at mental health. It didn't ever make legislation, but it introduced things like the mental health support teams in school. And it was really lovely to hear from Lily that she'd had that experience of working alongside some of the schools teams to produce your video. And I'm really looking forward to seeing that, Lily. That'd be great. So COVID hit, obviously, and then really, so that we had a really sharp rise after COVID in the reporting of mental ill health in our children and young people. And from a CAMHS perspective, and remember that CAMHS is the specialist secondary care service, so the sort of the sharper end of services. We saw a doubling in referrals. So from in 2017, we would have about 4,000. We had about 4,000 referrals. Today, we're up to 8,000 referrals. And at that particular time, and up until now, we've had no increase in funding. So, as I said, CAMHS is that specialist bit at the very end, and that would. Currently, it's funded for 45% of the prevalent population, so that's more than half that isn't covered, and that's really what that has driven the programme up until now. Was that what families would be telling us is that actually trying to get into CAMHS is really, really difficult. Often that sense of not being ill enough, because there is no early help mental health intervention. So we launched back in just before COVID, as part of the transformation programme that had started back in 2016, a consultation, public consultation called Your Mind, Your Say. And over a period of initially just before COVID, and then it was picked up afterwards, that consultation met with 49 groups of children, young people and parents, alongside various questionnaires to really get and think with families about potentially what they needed. And the key messages were very clear. It was actually, we want to be able to access support quickly. As I said, the experience is that people weren't quite ill enough, and people's mental health had to deteriorate before they could get into CAMHS. So this was around how do we get access, improve access, and get in quickly, and for parents and professionals to have a trusted place where advice could be sought. And that phrase, and I'm sure people are familiar with it, it gets talked about quite often these days about no wrong door. So rather than people being ferried around or passed from pillar to post to find help and support, actually it was what families said is that they wanted one place that they could go to and for the professionals to sort out who it was that was the best person to meet need, and that they did the work rather than families having to do that. So and they said very clearly that what they wanted also was to it didn't matter whether it was, and sometimes what families said is that we don't really, sometimes we don't know whether it's social care or it's health. We don't care really who gives us the support. We just need those agencies to work together better so that we get the support that we need rather than duplicating. So what the ICB, so Susie's organisation in NHS Dorset, then set about leading the system, so across agencies, 5 co-produced workshops. So that was back in 2023, just as when Elaine and I came to talk to you before, and brought together people from education, from local authority, both in early help and children's social care, voluntary sector and health colleagues, to look at, well, how do we redesign a mental health system that's fit for purpose? And at the end of those 5 sessions, and they were really, really positive, and children and young people as well in those sessions, really, really enthusiastic people, really, really blue sky thinking about how we as a system that have lots of resources, or perhaps not as many as we might like, but a variety of resources. How do we bring those together to create something that is meets need better? So at the end of those sessions, we came up with a model, a redesigned, integrated model for children and young people's mental health, based on the Thrive framework. I'm just going to hand over to Claire, who's going to tell you a little bit about the Thrive framework.
Yeah, very happy to. Thank you, Helen. So hello all, my name's Claire. I'm a consultant psychologist. I'm the service clinical lead for CAMS. So I work closely with Helen. My role is really to oversee ensure that the clinical model, so the help that we're offering to young people and families, is of high quality and it fits for what families are asking for, and is going to have the biggest impact. And as Helen said, to date, we haven't had a sort of a clinical model that's really allowed us to meet need in the way that it's changed over the years. So our existing framework is the old tiered model, which I'm sure all of you are familiar with, which is now completely out of date and you know, not fit for purpose. And that's what families are telling us very clearly. They fall through the gaps. They're not bad enough for this part of the service and too bad for that part of the service. And so they feel very much kind of pushed and pulled around the system, and that helps nobody. So we were very aware already that the service that we were delivering needed updating radically, and also the feedback from families only just confirmed what we already knew. And again, as Helen said, our service was set up to meet sort of less than 50% of the prevalent population needs. So we've always been slightly on the back foot, not only with the funding that we've had invested in the service, but also the model hasn't fit. So long overdue in terms of looking at how we needed to completely redesign the way that we work. And it has taken the time, and we've needed that time to listen to people and really gather their feedback and design it with them, rather than imprint a model that we think fits and actually families then tell us it still doesn't meet their needs. So we've chosen the Thrive model. This is not a new model. It's been around since about 2015. It's a model developed in collaboration with the Tavistock and the Anna Freud, and it's been adopted by around 70 different child and adolescent services across the country. So we're certainly not doing anything that's completely new, and we've been able to reach out and speak to a lot of services that are already partly implementing Thrive, to learn about how they found that, what families are reporting, things that they would do differently if they could do it differently. So trying to avoid some of those pitfalls. In order to find a good match for us to refer to, we've been looking to our colleagues down in Cornwall. It's relatively like for like in terms of population, but also geography. So our neighbouring Portsmouth also has some Thrive embedded, but it's a much more urban area. So we've taken some of their learning, but actually Cornwall has really sort of aligned with a lot of the way we work and a lot of the sort of more rural needs that we have in Dorset. So we know that Thrive, from the work that we've been doing, and we've linked in with the Thrive consultation team, so they've been really helping us think about how we could make it fit for Dorset. But certainly the research to date, shows some really positive outcomes in terms of sort of 45-46% increase in good advice, guidance, and signposting. So families knowing where they can go to get the right advice about the right help for them at the time they need it. And that's been hugely beneficial for families who have also told us, as part of our stakeholder engagement, that they don't know where to go. And they end up going to half a dozen different places before they sort of might luckily land on something that they feel does fit. That also comes through really loud and clear from our main referrers. So that would be education and primary care, so GPs. We'll say, well, we'll go to CAMHS because we don't know where else to go. We're a well-established kind of name. But equally, that can cause frustration because we are not necessarily the best service for families, and yet we receive the bulk of the referrals. So we end up having to kind of turn people away, and that's also no good for families at all. So the Thrive model really allows for better advice, guidance, and signposting, which is fantastic. What they've also found is that adopting Thrive has reduced sort of waiting times by about 30% in assessment. It's increased face-to-face contacts because it creates capacity elsewhere in the system, so families are more able to be seen. A lot of our families report kind of long delays between appointments and they're not really sure what's going on. So I think, certainly the model that we've reached out and we've found out about really fits for what families are asking. Thrive is also, for those of you who may have heard of it, but if not, it's a needs-led model. And really, as a system, that's what we're wanting to move towards. We need to step away from a medical model. We need to step away from a diagnostic symptom-focused model. And young people have told us that sometimes it feels like we're trying to put them into a box, which fits neatly for us, but absolutely does not work for them at all. And Thrive, that's completely against the Thrive principles. It's needs-led. It's understanding, not in terms of symptoms, but in terms of quite understandable distress in a wider context of understanding somebody's story. So I love it because it's much more of a kind of a human model. It really encourages that storytelling and that sense of acknowledging and understanding that actually, on many levels, the experiences that families have and the distress they feel makes complete sense when you acknowledge the wider picture and the context that family sits in and what they've been through. So it's very much a needs-led model. It's a partnership model. Central to Thrive is partnership. And most of the research that comes out of the sites that have embedded Thrive really indicates that it's absolutely enhanced in areas that have really strong multi-agency working, strong partnership working. So again, the years that we've been away from here, coming and talking about what we've been doing, a lot of that has been to reach out and engage with our partner agencies, where I think, if we're honest, Helen, we had relationships there, but they were parallel relationships. So we've got education running here, health over here, and if I had another hand, you'd have social care here. We're all doing something in parallel, and we're sort of talking to each other, but we're not talking with each other, and we're not making decisions together, and we're not inviting families to make decisions for themselves. So we've had to do a lot of looking honestly and acknowledging some of the things that we've needed to improve. And I would say, I think it really feels like we're in a much stronger position with our partners, and we've wanted to take them on this journey because Thrive isn't all about us changing as a service, it's a system-wide change, and that's a huge piece of work. And it's all about shifting culture, mindset, being much more collaborative and inclusive. So I think what we've done, we've gone big, go big or go home, I think is our motto. A lot of the ICBs in across the UK have partly embedded Thrive. We're doing the lot. So we're taking the whole model and we're throwing out the old model because really there wasn't much about it that families said worked for them. So we're introducing a completely new framework, and we've been doing that really gently and socializing people to the model, so people have heard of it, and then we're going to go out and do more workshops, and we've got lots of training, and but unanimously when we kind of present it, people go, yeah, that fits, that makes sense, why didn't we do this before? So as I say, we're in a fantastic position now that we've had the investment, and Susie can come in and kind of share, you know, the backstory there. We've had the investment, we've had the commitment for this programme, which is just extraordinary given some of the other financial well, difficulties doesn't quite cut it, but you know, the financial landscape is a challenge, and yet there's this commitment for how we can deliver a better service, a more expanded service, with early help front and centre, better access for families, and hopefully less of that kind of just lottery as to whether I find myself fitting in the right box or not. That will be a thing of the past. So there's work to do, but you know, I think we're in a prime position now to really deliver something really great. So yeah, exciting.
Susie, do you want to come in?
I can, yeah, thanks. Hi, everybody. Hopefully everyone, as Helen said earlier, I'm the project manager, so I've been sort of mainly leading on the process, business elements, the fun bits. So I think the work over the last year, so just to give you kind of a bit of an update on where we are and sort of where we're kind of heading now, the work over the last year has been sort of ensuring that you know, really good and sort of co-produced model and Thrive model is implemented in kind of place-based. So that's been working with a lot of your children's services teams, etc. And some of the sort of transformation that's been in place, that's around your early help strategies. All of that hard work over the last 12 months has then been led to development of a full business case that's been going through our ICB governance, and that's taken sort of around 3 or 4 months. Has had the most scrutiny, I think, any business case possibly that's been through, just based on kind of where you know, as people have said, the financial situation and where kind of things are at the moment. But the good news is in July we've got that approved through that kind of process. At the moment, it's phase 1 funding, and so that means that's the key elements of the model that we would have prioritised, which is around 2 quadrants of the Thrive model, which is the getting help and getting risk support. And that's the main gaps that Helen sort of alluded to at the beginning that we need to sort of pick up and address. So there's some other parts too that have been agreed around sort of bringing in the voluntary sector. So we've got Couth, which is a digital sort of online offer. There's a bit around accessing community support and services, and certainly bringing in some of the lived experience in terms of making sure we've got some experts and feedback around children, young people and their families all the way through some of that sort of next steps, so that it isn't just at the kind of beginning of the pathway. I think Helen touched on the mental health support teams in schools, so that will continue to expand. It is on a slightly different time frame to the rest of the sort of programme and project, because NHS England set those time frames and have mandated a sort of time sort of process and rollout, which is hopefully by the end of March 2030 we should have the whole of kind of BCP covered for that in terms of time frames. So where are we kind of now? So we've moved into, now we've kind of got the business case approved, we moved into the mobilisation phase. That's going to take around 6 months, and that's because we've got to transition all of the kind of governance, set up all of the work streams that we need to do to be able to make sure that we can now start to implement that in the way that you kind of expect to. So that'll be looking and setting up all of the work streams, you know, around communications, engagement, training, workforce, data, IT, all of the bits that kind of work around that, besides some of those sort of operating work streams that we'll need to look at the pathways and start to think about how we get to from where we are now in terms of services and gaps to how we make sure we set up and start some of that kind of implementation. So the hope is that from sort of January next year, so 26, that we'd start to see some of that kind of new model be implemented in terms of sort of people in, you know, bums on seats and people in place, that can mean that we can start to address, as we've said, some of the gaps and make sure that we're addressing, you know, the needs of children, young people around the sort of emotional and kind of mental health offer that we want to put in place. So hopefully that's that's covered that. I'm happy to take any questions.
Thank you very much. Yeah, no, that did flesh it out very nicely for us, but I'm sure we do have questions. I'm looking at the committee for who wants to start. I know Emily probably wants to start. Anyone else want to get there first before Emily? I'm going to go with David.
I knew as soon as Peter put his hand up, you go with me. Thank you. Thank you so much. Found it really insightful, really well presented, and the context was really helpful as well. The story behind the sharp rise and the gaps in how many people we could actually take care of the way that we'd want to. And you know, what I really like hearing is looking past the financial restrictions. Almost, we know that funding is an issue, but we've got to find different ways of adapting and being able to still provide a service that can help as many of our young people as humanly possible. I find this really interesting around the Thrive model, this understanding the human journey, that everyone's got a different story, everyone's got a different journey. And I think that's really key to bring that model to where we are today, which is a very different place the way we would have been when it was originally introduced. And again, I'm really pleased to hear around this reduction in assessment times, waiting times, more face-to-face interventions and opportunities there, which I know always saying are a huge benefit, given the fact that we've listened to everybody that was involved, that we've taken the time to try and get this right. So what I'm just interested to understand is how often are we getting feedback around the improvements that we're making, and what are our people that are using the service saying now, and how are we continuing to obtain that moving forward so we can gauge that throughout the whole process if possible, please.
Yeah, good question. So as part of the work that we do, she was mentioned earlier, Nikita, who's been working with Lily from the schools teams. She's a very key person in terms of working with our young experts by experience. So there is always a piece of work that we do alongside anything that we do that seeks to get young people's engagement as we roll out. So the reality is we're not yet in that place to make those changes. So they'll be coming. We're definitely doing that alongside BCP colleagues. So as part of that piece of work, we will be, and one of the things that we did in the workshops, and as we did the design, there was a sort of a rhythm that we brought families in to sort of check and challenge, and we'll continue to do that as we go through. So as we roll out various bits of the Thrive model, we'll continue to have those families brought back in to do that sort of check and challenge bit. So it is something that we do in health and in mental health particularly anyway, and we will continue to do that, and alongside our partners to get that voice as we go through.
Okay with that, David? Thank you. I'm going to go to Emily next, and then I'll come to Peter.
Thank you, Sharon. My questions are both how questions. So the first one was regarding the Thrive model, which I hadn't heard of before, and reading the paper, I did a little bit of investigation to learn a little bit more about it. So thank you for answering or explaining that in a little bit more detail. I just want to understand a bit more about how that theory becomes practical. You know, when you're talking about it allows for advice and signposting and reduces waiting times, just yeah, I know that's going to be part of the process and part of the journey, but if we could understand a bit more about that, that would be amazing. And then also you mentioned this is a huge change, you know, a whole new way of working. Again, thinking about the staff and the practitioners, the people who are delivering this, how are they being brought on board with this new way of working? Are they buying into it? What does that look like in a bit more detail? Thank you.
Claire, do you want to take the first bit?
Yep. I'm happy to do that. That's a great question, Emily. And that's what lots of people have said. Well, it sounds lovely. How are you going to do it? So if I take the different sort of parts of Thrive, so for those of you who've seen it, it's 4 needs groupings or quadrants. You've got your getting advice, which is good advice and guidance, which should be universally available, and it's not bad. It still needs a bit of work. Then you've got your getting help needs grouping, which is for families who may have emerging needs, or they may have chronic needs, but they are also self-managing. So there's also some protective factors happening for them, in that it's the difficulties they're having may well be affecting 1 or 2 kind of focus parts of their lives. It could be in school, it could be relationships, it could be home, but there are other parts of their life that actually they report going quite well, which allows for that targeted support and allows for us to get in there earlier. Now, this is what we are not able to do at the moment. As Helen mentioned, we've got our mental health schools team that does some fabulous work. But outside of that space, we have a big gap in that we have our specialist CAM service, but we don't have that early help offer, and we know we need to remedy that. So we've then got our more help, which is for families who have high level needs, high level distress. Lots of parts of their life are really struggling. And then we have our risk support needs grouping, which is for families, again, where there's high level needs. The focus is on safety, stabilisation. So these might be young people who are more at risk of harm to self or others, but they're also really struggling because of the needs they have to engage in help that is available. And that can be for many reasons. And we've also acknowledged that one of the main reasons is that the system has not been set up to help them, and therefore they've grown mistrustful of the system, or they've been let down, and they've felt quite neglected. So we know that we've got some work to do, and that's very much a multi-agency approach. It has to be around containment. We have to come around families and say, we're still here, even if at the moment you're not sure whether you find that our help's going to be useful, or you're mistrustful of it, or you find it very difficult to kind of be vulnerable with us, which is very understandable. Historically, the system sort of goes, well, we've offered you 3 appointments and you haven't turned up, so we're just charging you. So again, this is practice that just has created so many problems. So that's a big commitment from the system to say, we understand, actually, we need to continue being available. We need to continue showing up for you. And that's that trauma-informed. And also, we've got a high number of young people who are either on the assessment pathway for neurodevelopmental assessment or have a diagnosis, and they need something different. They need us to be much more adaptable. So these are things that we know we need to do differently. But in terms of drilling down into a little bit more of that detail, Emily, as you say, so at the moment, our service is, I'd argue, as clinical lead for the service, quite inaccessible, really. And because of the difficulties in access, it creates distress. So if I'm struggling, but I don't know I'm going to get help, I'm going to feel more anxious, and my distress is going to be higher. At the moment, we've got a paper-based referral system that has to come from GPs. Well, largely comes from GPs, but largely as a professional referral system. Young people can self-refer above the age of 16. That does happen, but they still have to fill in a form. So what we want to do is just take away all of that and just be, again, that human touch, as you were referencing earlier, David, about just talk to us. Okay, that's what system would feel really accessible. And we want to move to a conversation-based model, which essentially is a team of people all sitting together as an integrated multi-agency team. So social care, education, health, and health being us, but also being health visiting, school nursing, speech and language, so our wider health provision. And we need to be at the end of the phone, so somebody can call into one place, and whatever their needs are, they can get to the right person, rather than be told, this is the wrong number, you need to call, and then that person goes, oh no, sorry, not us, you need to call. So we're building plans around what we're calling at the moment an integrated front door, likely to change, but essentially what that describes is a one-stop shop where families and professionals can call when they have a need, and there will be somebody there to provide help for that need, no matter what that might be. We don't have that at the moment. You have to go to CAMS for this, you have to go to education for that, you have to go to social care for that bit, you have to go over here for this. But, you know, it's a very, very fragmented convoluted system for families. And actually, why don't we just bring it all into one place? Families have one number to call, and then at the end of that number, they'll be supported to get to the right place. But those right people will all be sitting together in the same place. So at the moment, these are discussions we've only really recently kind of been thinking through with BCP. They've been with us on this journey across all the time. But actually some of their programs of work are nicely aligning with our program of work. So we're having conversations about where can we share spaces? How can we all work in the same place? Why don't we just have conversations? Because these are all our children and our families, and we need to be working differently together. So the integrated front door is a big piece of work. That'll be 7 days a week. It'll be 8 till 10. So we know that families, children, many young children go to school or they're in AP, parents work, and yet we have a 9 to 5 service. I mean, you can see you can see how it goes a bit wrong. So actually we need to extend our hours, and that's what young people have said, that actually after school is the time when I might need to talk to somebody, and at the moment I've only got an hour and a half to do that if you shut at 5. So we're really thinking about how to create that access. That's sort of front and center for us, and new early help teams, which we don't yet have, and a kind of a better defined higher needs help offer for families, and also support for families when they're in more crisis or have a more urgent need. So we have that already, but we're strengthening it because there's parts of that that don't work well enough. So again, we've got our eye across all of the sort of needs groupings and thinking with the local authority and education about how can we kind of bring all this together, so we're working together, not alongside each other as we have done, but actually together to make these plans, a reality, and for that to be a very much a system change. Sorry, it's a bit of a long-winded.
And the second part of that, Emily, in terms of how do we bring the workforce alongside that? That's the bit of work that we need to do over the next the next year, really, because it's quite a different culture. It's a culture change piece. So we've got various things, workshops and consultations that we'll be doing, and recruitment. So part of the things that we've got to do is we've got to recruit over 100 people to come and work in this service, and move it all around. So that's the piece of work that we're just about to embark on. So if you've got any ideas in terms of how we change culture, really pleased to hear about it.
Thank you very much for your answers. Really thorough. Thank you.
Yeah, I have to say, you get a real sense of the enthusiasm for the model as well from Claire. And the culture shift, that cultural thing is hugely difficult. I was going to ask about that, but as it hasn't really started yet, then I won't pursue that any further. And I don't want to delay Peter any longer.
It's really good. You've answered a lot of what I was going to ask, but there's a couple of things about, one about the barriers to self-referral and the referral process, and how far are you ahead in breaking those down? The information and guidance access, and the thing about youth work pilots and the access to creative and physical activities. I wonder how they tie together in terms of the youth work employment and where they come from and how that manifests itself. I'm pleased to see that the landscape that children, young people and families have to navigate is really being thought about, with a heart, really. It's really, really good. And in terms of interviewing, I hope you're going to involve young people in the process, and families. That'd be really good, because we've always been really good at that. So you can come and talk to our participation team.
Mm-hmm.
Absolutely. So the youth work bit, Peter, is very much a part of the, this is a system coming together. So we would absolutely see our targeted youth workers working alongside the health component, and as part of that early help, or getting help as we're calling it, team. So yeah, really positive. And one of the things, Claire was saying about access, obviously children don't pick phones up. They don't. A lot of children find it quite difficult to call. Parents are much better at it, and some would still struggle. So we need to think about how digital ways that young people can kind of connect in, and some of the things that we're thinking about for that evening, often when young people are at home, that sort of online connection, the online therapies type thing. One of the things, I don't know whether or not you've had Kuth talk to you, but the sort of having a therapist at the end of an online email, how we bring those sorts of things to really need thinking about when children and young people are in need, really, that we're there as a system to kind of meet that need. You asked something else and I can't remember what it was, sorry.
Was it around advice, guidance? You might have to say it again,
Yeah,
Peter. I don't want to miss your question.
Oh yeah, the kind of collaboration about information and guidance and data sharing, that kind of thing. How it's about how that occurs. That's quite a complex landscape, isn't it?
Yeah, absolutely. So we would be. I mean, I mean, people will know this. There's lots of stuff out there. There's loads of information, and it's about how we bring that together in a trusted, safe place. And the reality is, for years and years, people have said, "Oh, what we need is a directory," and we'll just, and Dorset Youth actually pulled together. We're given some money by the ICB to pull together a directory. Then it's about, well, okay, how do we publicise that, and how do we have a place where there's information that people can access and find it useful. And that's the bit around some of the somebody that we were talking about earlier on, about how do you get young people to input into that, to say, well, okay, from a social media perspective, what is it that you actually need, and how do we safely give you that information? So all of that will be part of the project as we go forward, so that there's places where young people can access the information that they need, and we can feel that that those places are well regulated, and we're happy about the information that we're giving our children and young people.
And I'd also be very interested, or it'd be good for us, about your partners in Cornwall, seeing as they've been very influential. I mean, who were they, and if you don't mind?
No, I don't mind at all. I've got a list of names actually, Peter, so I'm probably not going to be able to pull them all out. We have spoken to so many different CAM services over the last year or two. So a colleague of ours, Teresa Syred, who moved down to Cornwall, probably was 2 years ago now, has been a really good resource, because she moved across and took up a kind of a service manager position. So we've met with her about this program, just from tell us what's happening and how it works, but also from some of their neurodevelopmental programs as well. So, and of course, there's a lot of overlap between our Children, Young People and Families program and our neurodevelopmental transformation program as well, which obviously is independent but completely links in with this one. Yes, can't pull the two apart. But we've also, Berkshire have also been a really good source, because they are slightly further ahead and have done it differently to Cornwall. And I think that's the thing with the Thrive model. There is really no one way of doing it, which is great. Although it would be lovely if somebody said, well, here's the model, go off and do it. But actually, as what we've been able to do is really take the fundamental principles and then reach out to people and say, well, how did you interpret that? And then sort of hold in mind, would that be what we need in Dorset based on what children, young people and families are saying they need? And some of it definitely, but some just hasn't fitted, and that's fine, because there's flexibility in the design of the model to really make it bespoke to your community and your area. But it has been really helpful just to kind of reach out to other areas and say, we're thinking of this, is that something you've done? Or, you know, what might you've done differently? Or, you know, how did you do your engagement? Or how have you done? What outcome measures do you use? We're never fans of reinventing the wheel. So actually, if we've got people who are doing who are implementing Thrive, so much to learn from them ahead of where we are. But equally, our model is really unique in that we have gone for whole system change because we committed to doing that, and luckily the ICB and our leadership within our trust have been behind us all the way, rather than just doing bits of it. So I think in that sense, we've had a lot of contact from other parts of the country, learning what we're doing in Dorset and wanting to come and say, that sounds amazing, we didn't manage to do that, how have you done that? So I think what we're doing here, and I know I'm going to say that because my service, I'm very passionate about it, but it is actually really extraordinary. It's also huge. So it's exhilarating and terrifying in equal measure, but actually the potential for the difference that this can make to families is really, 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 really massive. And I think we have taken people through this journey and really sort of got some energy behind it. And I think people are, you know, change is difficult and people are familiar with the system, even though it might not be working, it's still safe, secure, because it's familiar. Change can feel very scary. And we've been really mindful of that. So coming out, having lots of conversations, kind of opening that up to teams who invite, challenge. You know, none of this will be perfect, but I think we've got that sort of open-mindedness to it, and you know, inviting lots of voices in to say, well, have you thought about that? And I'm not sure that will work. Yeah, sure. Yeah, absolutely. I hadn't thought about that. So I think on the ground, it's felt quite collaborative, and that will continue as we go forward.
Okay, thank you very much.
Yeah, thank you. It sounds really good bit of work. Thank you.
I've got two more people in the room. I've got a couple of questions as well, so I'm going to go to Sandra and then Ollie.
It's not necessarily a question, it's just for the benefit of the committee. K-O-O-T-H, not as in uncouth youths.
Yeah.
Thank you.
Thank you, and thank you for joining us today and for your passion and your responses, and it's been amazing to have you. So one question I had, a lot of this seems to be around removing barriers and making it a lot easier for people to get help when they need it, and that's incredible. Is a foreseen byproduct of this that you're going to receive quite a lot more referrals coming through, a lot more requests for help? And if so, will it impact the wait list because you'll have more people coming through, or is the new system in place to stop that from happening?
That's a good question. So part of this is about building in resource. So it is, and for it to work in the way that we want it to work, there needs to be a quick access and moving people to parts of the system that can meet their need. So it will be, I think, and also, so there has to be something acknowledged, I suppose, that where we start is with a population who haven't had their needs met for a long time. You know, we've had 10 years of austerity, and families are the family system families are under a lot of pressure and stress. So this is not a system that's going to suddenly turn everything around in the next, you know, year. It's going to take time for us to, but what we absolutely recognise, and I'm sure Kathy would say this too in social care, is that getting back and getting in early stops people deteriorating, and if you can meet need early, then that's great, and you'll stop the complexity at the end. We have a lot of very complex families in our system at the moment, and managing that alongside bringing in and meeting need, what we would hope to see is a rebalancing. So, and we need together as agencies to wrap around families earlier will stop the number of complex families that we see at the moment going up. So we're not anticipating waiting lists. We've got a bit of a juggle to do at the moment. We need to rebalance our system, and that's what we're going to be doing over the next few months in terms of meeting need. But yeah, no, we're not the types of interventions that we're offering will change as well. So we might not see so many people being in therapy for a long period of time. We might need to, well, we will be changing some of that model. So that traditional kind of CAMS model will be changing over time, but it's not going to kind of happen straight away. We recognise that it will be a number of years whilst we begin to rebalance, and it will take time for us as a system to come together to change things. Social care are often, or local authority are often better at moving quickly, much more quickly than health. It does take health quite a while to turn itself around, but we're well placed to get on and do that.
Can I just add? I think we've done quite an extensive amount of sort of needs, looking at the prevalence, some of the modelling. In the business case, what it means is that hopefully we've resourced this really well in terms of being able to do that kind of across the system, and try and minimise those gaps and join things together. So I think that's going to really help in this sort of situation, rather than just looking at that sort of 42%. We've now got sort of the resource allocated based around that Thrive model. So that's been really key to this, I think, as well, that will support some of that.
Brilliant. Thank you for those answers, and thank you for everything that you do.
As I don't think there's anyone else, I shall ask my questions. So I was just wondering, I love the fact that this is clearly a person-led, person-centred model, not, like you said, not medical, not about the institution, things like that. I just wondered, is there anything within it that's different for the transition point, from CAMS into adult mental health services? What happens? Is there anything different about how that is handled within this model? I'll go with that, and then I'll ask my other question.
Susie, do you want to pick that up?
Yeah, I think probably at the minute we've got we've just started recently a sort of young adults transition working group to kind of look at some of the detail around that, because we recognise that at the moment we've had a number of sort of adult mental health transformation that's sort of been in progress, and what we sort of need to do now is look at how the two align. Both transformation programs, so this children, young people, and the adult one, is very much moving to that sort of needs, sort of less diagnosis driven. So we're hoping that as part of some of that work, that children, young people, if they do need to move into adult services, will be able to sort of, transition over in terms of staff working together in that kind of integrated way that we've talked about for the wider system. So that's the kind of hope at the moment. I think there's a bit of work to do at the moment to do that. I think we've been getting that, the kind of children, young people's model kind of working and understanding where that fits. So I think very much on the radar now for us to look at how we then think about how that links in. Also aware of some of the local authority sort of transition teams, and they've been very much part of the discussions to date in terms of the wider programme, and we'll be picking those kind of back up to bring them back into that conversation, and yeah, hopefully we'll have something and a bit of a plan around how that might look.
Thank you, that's good to hear. And my last question is, it's around the fact that a lot of the people in your system, in the CAMS system, will be people, or children and young people with SEND, a SEND need. And you could argue that perhaps they wouldn't need CAMS if their SEND need had been picked up earlier. So there's clearly a sort of an interface between the health and the local authority. And I just wondered, how is this accounted for when setting and sharing budgets and strategies between the health and the local, between health services and the local authority?
That's a good question. Susie, do you want to pick that up? You're the
I'd
budget
say,
person.
yeah, probably not very well at the moment.
So
I
does anybody
think
want to answer that?
I think the hope is that there's certainly talk around sort of joint commissioning arrangements going forward. But I think at the moment we've obviously got a lot of ICB change going on in terms of sort of mergers and national changes at the moment in terms of where work streams are. And we'll be working and moving to more sort of place-based partnerships. And I think that's when some of that kind of joint commissioning and opportunities will come out. We are closely, so I do closely work with our SEND team and with your SEND team. So there's a lot sort of crossing over in terms of making sure, because SEND, along with some of the other needs of children and young people, would sit sort of under a health inequalities work stream for us in the NHS. So we're very much thinking about, you know, how are we going to meet the needs? This model, we're hoping, will do that, because it doesn't, you know, kind of differ between those different needs, but it's around identifying what are the specifics, and maybe there's some things that we need to consider as part of that. But at the moment, from a finance, as far as I'm aware, it's all kind of still quite separate in terms of the way that we'll set up, but certainly working relationships are there.
Thank you very much. And yeah, there are no further questions. Oh no, there is a question. Sarah.
Thank you, Chair. It was just hearing your last few points actually just triggered a bit of a thought for me. So in terms of this being like needs led, what with this sort of change, do you envisage seeing any changes to how you gather data, how you undertake assessments with young people, and particularly when they're transitioning, and how do you ensure that what's available sort of out there is going to meet their needs? And my further point is about evidencing distance travelled and the impact of this change in how you're going to deliver the services. How will you show that, both from a young person or child's perspective, but also a wider perspective, like the impact within their family? Thank you.
So I can answer a little bit just in terms of, so we have sort of, in terms of data, we've got external and internal kind of expectations, I suppose would be the best word. So we have to report up through a mental health data set, which goes up to NHS England. They hold that as a collective reporting, and then obviously they meet with us to look at various things. So they're always looking at access, sort of waiting times, sort of referral to assessment, referral to treatment are two of the bigger ones that they would look at. They'd look at population numbers, then they'd look at prevalent population, and then they'd sort of work out what our access targets need to be. So those are things that we have to report up, which I'm anticipating to stay the same, because that's kind of a bit of a static data set that not just us, you know, obviously CAMs across the country are expected to report into. And we have a business and performance team within Dorset Healthcare, which are responsible for looking at how well we report on the data that we're asked to provide. Internally, we've got a lot more flexibility in terms of whether we feel what we're measuring is valid, in that it measures what we want it to measure. And I think so far we haven't really got that right. And young people will say that the measures that we use don't sort of fit for what they're experiencing. So we've brought online Cork, which is the Child Outcome Research Centre, to support us with this going forward, and they will help us look at what data we intend to capture. The Thrive team, the consultation team, have come in and also thinking about how other services that have embedded Thrive have shifted some of the ways that they capture that data. Because for me, it's largely is, are we making a difference in terms of, are we making a difference to families sort of leave the service? For me, it's not necessarily about symptom reduction, but that's a component for a lot of people. For me, I feel we've done a good job. If families leave feeling well understood by us, but also increased understanding of themselves as to how did I get here? How did what I've been through impact me? And how can I take this forward? So we must empower families to think about what help they need for themselves, but also how to help themselves as well. We've set up a service which for some families has created or actually not really installed any sense of empowerment. So it's a sense of I come to you as a service and you tell me what I should do, rather than, no, this is a collaborative discussion that we should be having with you to say, well, we can support you in this way, but we can support you to support you. So actually, you will outlast us. You know, that's got to be our aim, that families feel supported, feel strong, and feel able to go off without the need for services. And I think services, not just CAMS, but the system of services hasn't really enabled that. And hence why families can feel quite abandoned and feel quite rejected when they are discharged from services, and that doesn't feel like a collaborative process either. So I think there is an element of it for us about what difference are we making. For me, it's about empowerment, understanding, families feeling heard, feeling validated, feeling seen. That's fundamental. For me, it's a benefit if they come in and their anxiety experience is really high and they leave with it a little bit less. But actually, for me, that would be a kind of an added bonus. Actually, for me, we need to acknowledge again, as we were saying before, that actually for some families' lives, anxiety is incredibly functional, as is low mood, as is the responses they're having in relation to traumas they've experienced. And it isn't for us to say, we'll get rid of all that. It's really for us to create a space where families can understand the value of some of the ways they're managing, learn some different ways if they feel that's useful, but actually be able to take some of what we can offer away and feel able to continue living their life, which may still involve levels of worry, anxiety, low mood, because life happens in that way. So I think we know we need to bring some partners on board to help us really think about how we're going to measure our service. And we've built that into our implementation plan in relation to regular reviews as we go forward with our mobilisation about how do we know we're getting it right? What do we want to see? How are we going to measure that? And that's a piece of work we still need to do, but we're very mindful that we need to be really clear and have that conversation with families so that when we get to those checkpoints, we've got something really clear to mark our homework against, I suppose.
Thank you very much. I think there's been an incredibly full debate, actually, and what was a very short paper, we knew that it was going to be fleshed out, and I think you've done a brilliant job of doing that, so thank you very much indeed. The recommendation of this is for us to note the report, which I think, you know, we're happy to do. Obviously, well, I'm looking around the room, I'm guessing we're happy to do that. But I do also think, and given that you've talked about things that were, you know, sort of looking at taking another 12 months or so to come on stream properly, I wonder if we want you guys to come back in 18 months. What do we think? Yeah, does 18 months, I'm looking at the three of you now, because does 18 months feel like the right period of time?
Yes, potentially, but we're happy to come back before if we're needed. So if people would like us to come back before then, we're happy to. But 18 months, yeah. But I mean, we should have be much further down that line. So yeah.
Thank you. So I'm going to propose that the recommendation is that the recommendation is we note the report, but that we will get an update in 18 months. I'm proposing the March 27 meeting. And so we can put that on our work plan. Is that okay with the committee? Thank you. So heartfelt thanks from all of us in this room for the work that you've done on this and for your presentation this evening. We will let you get on with your evening. Thank you very much indeed. Helen, Suzanne,
thank you.
and Claire.
Bye-bye, everyone.
Many thanks. Bye.
So as we continue, I'm conscious that the next paper is probably going to bring fairly extensive debate. I'm actually going to propose a quick break at this point. I don't normally have a break in our meetings, but I think it's probably the best thing to do. So given that it's just on 7:30, if I say 5 minutes, it'll be 10. So we'll come back at 22, but aim for 25 too. We are now moving on to item 8, which is our SEND improvement update. And so I'm going to hand over to the Director of Education and Skills, Lisa Linscott, to present, please. Just a small technical issue. Hang with us while we sort that out. For the benefit of people online, we're just waiting for a microphone to spring into life. Hopefully that will happen in the next few seconds.
Does that sound like that's working? Wonderful. Okay, so thank you. Within what is undoubtedly a challenging national context, we are building firm foundations and doing things in the right way in terms of our SEND improvement. And I don't intend to try and summarise all of the paper because there's a lot of detail in there that I know you will have gone through, and I'm sure there'll be some key questions you want to ask me. What I'd like to do is actually introduce by sharing with you some feedback on our partnership and co-production that I believe is absolutely at the heart of those firm foundations that I've just talked about and the heart of doing things right or in the right way. So our Parents and Carers Forum, PCT, Parent Carers Together, have shared with us that when asked how have we worked in true partnership and co-production, they've shared with us that BCP and NHS Dorset have done a lot to develop genuine partnership and co-production, and the work has produced more inclusive, responsive and effective services. The area partnership has embedded co-produced values of trust, empathy, belonging, communication and respect within a shared vision for improving the results for children and young people with SEND. And it's evident in the development of the co-production charters that are co-designed by young people, parent carers, BCP Council and NHS Dorset, in which every voice is valued as an equal partner. There's dedicated co-production time with priorities showing through the belonging strategy that have been shaped by broad consultation with families, practitioners and stakeholders. And parent carers together themselves have a strategic function in advocating for families with SEND on governance boards and working groups and influencing design and delivery of services. And there are regular workshops and local events encouraging open debate with findings from research feeding into new plans directly, for example, the SEND Sufficiency Plan, underpinning a culture of meaningful involvement and continuous development. We then asked the question, what difference has this made to the lived experience of our children and young people with SEND? And they said, young people and children with SEND in BCP are experiencing swifter, more imminent support, increased inclusion and enhanced advocacy. Developments in timeliness within EHCPs, earlier identification and emotionally safe participation have empowered families and opened up real pathways to adulthood. Creative outreach and co-designed materials are aiding the development of trust and visibility, while diagnostic delay and inconsistent school culture does remain. The system as a whole is increasingly inclusive, trauma-informed, and informed by lived experience. Overall, it is a mixed bag, a work in progress. Some really good, effective work happening. However, while families report feeling more included, more respected, and more empowered to influence the services that shape the lives of their children, there's still work ahead, specifically around consistency, continuing to build trust, and shortening waits. And yet the progress towards genuine partnership has already started to create hope. So I wanted to share that with you as a kind of opening gambit to the questions that you might have about the paper.
Thank you very much. I have to say, I think it is a really good paper. It's a very full paper. So I think that opening complements it, very nicely. It gives another context. I'm looking around the room for questions and comments. I know there must be many. Who is going to kick off? Peter.
Yeah, thank you for that. I mean, it's a really difficult situation that we're in with SEND, because the system is broken, and you've got a really difficult job on your hands. And you know, looking at the future, the autumn statement that's going to come out about money that might come in. I'm going to refer to Millie's letter a little bit that she sent to the government, and what kind of issues came out of that for me, if that's okay. So that I think we need to look at sustainability and risk with under, you know, future funding, and how that's going to impact, and be sort of looking at the, you know, the elephant that's in the room, but there's also another one on the horizon. You know, that kind of, you know, the budget oversight in terms of how we scrutinise our own budget with children's services, how we're spending it, kind of where we're spending it. That inequality that families are feeling, and it's nobody's fault. I'm not pointing the finger at officers, or this is about a lack of money and lack of adequate resource to do a really, really difficult job. But what's emerging on the in my local landscape, and I'll stop and ask another question after this, is the inequality that's arising between families' experiences of accessing plans, SENDIAS, BCP workers to help them navigate the kind of the landscape. So I know we've got a really good system growing, but I think we've got a lot of stuff that can knock us right off the pitch if we don't foresee our financial situation, the long-term impact, look over the horizon and say, well, this is the money we've got. You know, what if not enough comes in? And I think that's the biggest question for me, is what if? And how are we planning for that now? And I'm sorry it's such a jumbled one, but I get all a bit tied up and tickled too with this stuff. But I'll ask something else later. Thank you.
I think that whilst as we're both saying, the national context is really challenging, there are also opportunities in the direction of travel nationally. The messaging that we're receiving already, although obviously we don't have full sight of any legislation change quite yet, is the direction of travel is about support first. It's about early intervention approaches. It's about multi-agency teams wrapping around schools, wrapping around families, helping build schools' skill and capacity to meet need at an earlier stage. And our own plans are looking to do exactly that. So we're looking at our workforce development programs across our schools, what that looks like in terms of inclusive leadership in schools, how we develop our support whilst waiting, and that no wrong door approach that we've heard a little bit about from the team earlier, providing that support before a child needs an education, health and care plan is a really crucial part of that. At the moment, the system is stuck and families are stuck feeling that their only option is to turn to an education, health and care plan, when actually there are other alternatives if we develop them well. And I'm not saying that those alternatives don't also cost money, of course they do. And we're going to need to make sure that we boundary that work really carefully so that we do manage the funding appropriately. Getting support right for families of children with SEND is always going to be a costly affair for sure, but it's going to be much more costly if we're always resourcing at that very top end of the pyramid rather than resourcing really well at the bottom end of the pyramid. So that direction of travel is absolutely one that we want to follow and are committed to. And I don't know that I can answer further in terms of what if not enough comes in. We will always have to work within the resource that we have available to us as best we possibly can.
So in terms of the future, are we lobbying government? Have we, you know, are we looking at our long-term BCP vision of what the impacts of not having? I know this is very negative, but we're all working with families that are struggling. you know, lobbying government, talking to government, you know, bullying them about what their long-term plan is, how much money we might get, and if that's not enough, what are we going to do in terms of external funding and other funding resources? I sound heavy, don't I? Sorry.
I think, thank you, Chair. I think you sound as heavy as we feel, actually.
Yeah, okay.
You know, wanting to drive and strive for a service that meets need as at the point of the need, of not, as Lisa talks about, that pyramid, getting in there really early to support families and generally meet need and inclusion. The budget is a challenge. It has always been a challenge, and the challenge increases with the increase of demand. I think that I'm not sure the word bully, but there is representation that is made at all very different levels. So Lisa works and is supported by the DFE. We've got a DFE advisor. We talk about budgets. The finance 151 officer is part of our SEND board, and so he will raise that issue. Obviously, the 151 officer and myself at different levels with government talk to them, and then again, obviously, Millie makes representation. And so we also do that collectively with other local authorities because we are not alone. We do have some circumstances which are individual to BCP. We have sought to support, specific support, but we also work on it collectively with other local authorities.
Thank you. I know Sandra would like to come in.
Hello, just a comment, and not to be negative, but it costs more money if we get things wrong.
No, that's very true, and we heard that from the team just before. The sort of getting it right first time model is absolutely right. It does save money, certainly in the long run. On that topic, actually, I have a question about tribunals. It's one of the things that's mentioned in the report, and my comment is it's obviously very good to see the reduction in numbers and that we have a relatively low rate, or good, a low rate of tribunals. But I'm still interested in sort of fleshing out the causes of why things might go to tribunal, and I'm still not clear on how many of those we lose and the costs associated with the whole process around that. And also, any tribunal, again, not trying to be too negative, is a form of failure, isn't it? Because it brings in delay for help for the family and for the child, and increased costs for us. So I suppose I'm wondering what work we're doing to continue to try to not have to resort or go to tribunal at all. I mean, I would imagine that the aim is to not have any tribunals, although I'm sure that that's not possible. There will always be some situations, but do we feel we can bear down even further on those numbers and the costs associated?
So tribunals in large part are connected to choice of educational provision, and if a parent or carer doesn't agree with the choice that has been named in the Education, Health and Care Plan, then in that section, that will quite often lead to a tribunal situation. However, we've worked really hard on reducing that. And if you look at the number of tribunals in relation to the number of EHCPs that we have, that number is actually falling, which goes against what's happening nationally. And we attribute this in large part to the early dispute resolution work that we've been doing. So that's about our education, health and care coordinators and our team managers working directly with the family before it needs to get to the point of tribunal. We then follow that up if that doesn't succeed at that early stage with formal mediation. And we know that we've heard through our parent carer forums that our families prefer to resolve matters as soon as possible and at the lowest level. And so we think that that response is working really well. Their lived experience of mediation is largely positive. And the same is true for our young people. So I read today of the lived experience of a young person who, post 16, challenged our decision not to provide him with an education, health and care plan. He welcomed the support from Sendias as part of that to help support him through that early dispute resolution. And we decided that at that point we felt he had really clear justification that we hadn't understood well enough before, and we did give him that so that he could then get through his post 16 and then be successful in that and get to university. So we can absolutely see that there is learning for us in going through that kind of way of working, as well as getting the outcome that works for the family. So we do want to grow that. And obviously tribunal is a more costly route anyway, costly in terms of finances, but also costly in terms of the weight and therefore the emotional strain that that places on the family while they're waiting. And are you able to share those costs with us? I haven't got that directly in front of me now, but I can provide that if that's something that you would find useful. I have another question that relates to paragraph 11. It's under areas of focus. And I believe this actually comes back to a question that Mr. Sofianos asked a while ago about the demand for EHCNA or EHCN assessments. And it's talked about 26% of assessment requests were made by parents. And I just wondered, does that mean therefore that 74% were made by school, or is there another number in there as well? I just wondered how that was actually broken down in terms of the actual 100%. The other percentage is schools. Right. And so it's a straight 2674. And that percentage is coming down over the last few months. So we've seen more coming from schools and fewer coming from parents and carers, which is where it should be. David, over to you.
Thank you, Chair. Just on schools, actually. So I was reading here around, quite rightly, please just let me find the... so under Section 9, complaints. So improved communication with our families. Improving communication with families remains a key priority. So absolutely appreciate and understand that and agree. But can I just check where we are with the schools? So I know that we talked around the inconsistent school culture. I think that was what I picked up in the introduction. And just the importance of where we see this can be improved and where the gaps are. And I guess that's just through speaking with, people in schools and how they feel that communicating with the council can sometimes be quite frustrating in terms of timing of correspondence, falling at really inconvenient sort of odd times, but also just around how we can speed up that process, improve that relationship so that wherever possible we can have children in school more than not, and parents aren't having this kind of real difficult decision about whether or not they try and keep their children in school, even though they're not very happy, just to get some form of education, or they have to make the decision to keep them out of the school for the right provision or whatever it could be. So that's kind of the first element of a question around schools. If I can start with that, please. Thank you.
So if I split that into two and just talk about communication improvements first and then inconsistent school culture second. So communication improvements, we absolutely do recognise that some of our our failings have been in relation to our communication not being timely enough, or not being done in the right way with families or with schools. And that's something that we have been working really hard on, and we continue to work really hard on. We have stabilised our workforce in the statutory SEND team, so that then when we're putting that effort into the training and support and induction of those staff members, they are staff members who are going to be permanent staff members. And that there is ongoing training, workforce development in place for that team, specifically including around how we communicate with families, how we communicate with schools, making sure that it's really warm communication, but also improving the efficiency of our systems. We're working at the moment on the introduction of the proper use of a portal, so that everybody, schools and families, can see everything at the same time as we can see it, because that then obviously cuts out the back and forth. So it's both things really. It's about system improvement, but also warmth of communication. And then in terms of inconsistent school culture, and it's to be noted that the challenges for schools are really greater than they've ever been in terms of everything that they are trying to manage. So that inconsistent school culture needs to be kind of seen within that context. We are introducing inclusion advisors who will work with schools at that whole school leadership level. We have secured funding that's enabling 50 of our school leaders to attend an inclusive leadership course run by the charity The Difference, which you saw referenced in the paper. And we are rolling out more outreach into our schools, and much more focus on training and support so that they can meet the need at an earlier stage in school. All of those elements are part of that early support that I was talking about in my introduction.
Thank you. Can I just also ask around line 43, so just on the dashboard around staffing? So just understanding around the staffing, we've got 3 green, then we've dipped down to 4.4. Just understanding kind of what we expect the trends continue at, and what potential challenges we're going to face if this continues to sort of stay in the red in terms of any impact on reviews being undertaken, or any sort of urgent issues that come or arise being addressed in a timely fashion.
So permanent staffing is now up to 93%, but ultimately the staffing is the staffing that we have available to us within the resource that we have. And the more education, health and needs care assessments that we have, and therefore the more education, health and needs care plans that we have, the harder it is to meet those statutory timescales. And so it still comes back to that need to help and support families and schools to meet need without always having to resort to an education, health and care plan. We're already at quite challenging numbers in terms of the number that we have in total is around 4,700 EHCPs now. So we can only go as fast as we can with the numbers of staff that we have available to us.
Over to you, Ollie, but I just wanted to ask about the timeliness on the EHCPs, because we are seeing that dip, and I just wondered where we were, what are the latest figures on that, and what is the plan, as it were, the mitigation plan? Apologies, Ollie, I'll come to you next.
The timeliness currently is 68%, 68.5%, which is above national and statistical neighbours currently. It has come down from sort of up when we were up at 99%. and that is partly due to the fact that we have to work within the resources that we've got against the demands coming in on the system. But we are still holding ourselves above national and the Southwest statistics, which I think are a lot lower.
So we're going to just hold at that, as it were. We're not. There's no sort of recovery planned for that.
There's no funding for recovery, but one would hope some of the work that we're doing that's described in the report. But equally, I think you know, as long as we peter out and level in terms of demand, we will have to see. But I know Lisa is doing the service and Lisa are doing a number of things to try and manage it and be more efficient and effective. So you'll see, I think, in the report about EHCPs being done through AI and things like that. And so it's just speeding up some of that system. So yeah.
I'm really sorry, I'm conscious about coming to you, but I had another question about that AI, actually, if that's okay. Because I just wanted to understand that a little bit, because I actually shared this with you. I had a little bit of feedback around some parents having been, you know, unsure about why the form had been changed, or, you know, things had been changed around that. So I just wondered, are we keeping people informed about how we're using AI and what the changes might be in the process because of the use of AI? And is it a use of AI that people at the front door, if you like, would notice?
So any changes that we've made to the actual pro forma have always been done in consultation with our families. And those changes that were made last time were made to bring our plans more in line with the potential for a national pro forma being rolled out, which actually then the government haven't rolled that out as yet, but we were bringing ourselves in line with the work that the government were doing on that. But it was done very much with families, and the use of AI, it will be exactly the same. We will make sure that through our parent carer forums, we are working with our families on it, and we are not in this instance ahead of the game on using AI as a tool to help produce really consistently well-written education, health and care plans. That's something that's being used in a lot of local authorities already to really great success. And it doesn't take away the human element of writing an EHC plan, nor does it take away in fact, it adds more capacity within the teams to actually be able to have really good communication with the families, because they've got a little bit more space and time to be able to do that. It will improve the consistency of the quality of our EHC plans, which are gradually improving anyway, but this will help that to improve much faster.
Thank you very much. That's reassuring to hear. Ollie, over to you.
Thank you. What percentage of the educational psychologists that we use are outsourced?
I can look up and come back to you on what the split is. I think the thing to be aware of in terms of that split is that the outsourced educational psychologists focus 100% on statutory assessments, whereas our internal team are able to split their time between doing statutory assessments and doing that early support work that schools and families really need. So actually at the moment, having an external team who can do a significant proportion of our statutory work is beneficial to us and costs us no more than if those workers were working as part of an internal team.
Thank you. Just curious, and this is more of a suggestion, I suppose, than a question, but I know that in the clinical psychology space, their courses are funded and they also get a salary alongside doing so. In the educational psychologist space, I think they get a bursary of about 16,000 a year, but they don't get any kind of remuneration on top of that. I'm wondering if there's any way that we could potentially look at creating our own kind of graduate scheme internally so that we can hire people straight out of university to come and work for us. Or alternatively, and I know this would probably require some kind of conversion to the qualification, but if we could do some kind of immigration sponsorship for people who live in other countries that might have the correct qualifications to be an educational psychologist, and then we maybe sponsor application, bring them across here, and then get them working for us. So we're less reliant on outsourced bodies, but also so that we can try and claim some of the talent out there, because I know there's an unbelievable shortage in educational psychologists across the whole country.
Thank you for the suggestions. I mean, obviously, we look to bring on board assistant educational psychologists already, and we work closely with the universities that are offering the educational psychology scheme. So maybe there's further conversation that we can have with them about how that could work, and about any other sponsorship opportunities. So thank you for the suggestions.
Peter, back to you.
Okay, thanks, Chair. Just skipping back a bit, something stuck in my mind when you were first speaking about inconsistent schools practice, and I just wondered how we deal with that and what influence we have to get a generic approach. So how are we going about that? Have we got any authority to do that?
May I put a supplemental on that, because
Yeah.
I think it's quite similar. It may be a different tack, in which case you can shout at me. But like one of the things that you talk about is the schools requiring EHCPs before accepting pupils, and that just doesn't seem to be sort of inclusive. And I'm just thinking, is that the sort of inconsistent? Is that what you mean by the? I don't know. It may not be, but anyway, it's part of that sort of mitigating against what is the direction of travel for inclusion. And I thought perhaps it was one of the inconsistencies. And just how do we navigate that with schools?
Can I just, sorry, Chair, to butt in as well? My question is a bit similar, but it's more to do with how are we supporting those schools? Because I was really pleased to hear you say earlier that, you know, we are supporting schools for that, and you are recognising, because in the past I think there's been a lot of discussion about schools need to do more, but at the moment that it's much more rounded now that we need to help schools more, because I think there is we're saying we're up to 40% now, you know, but it's rising continually. But really for me it's, you know, is there something there is there an oversight from the council to ensure they're supported? Because then I think then we get to a reduction in exclusions, reductions in AP, because we have got more children with more needs in the mainstream system due to the way the system is now.
I mean, that question's expanded. I think it's really, no, it's really good. No, because it's a Pan's Labyrinth, that question, because, you know, inside we're all kind of capitalists, I suppose, and in terms of unless we overthrow the system, which we're not doing, but in terms of that, you know, in the old days, BCP or Poole or Bournemouth or Christchurch used to sell services to schools. And I just wonder where we are in terms of that financial map. If we are going to collaborate, I mean, we mustn't forget schools' academies. They get separate funding. A lot of that funding goes out from the school, not to educating young people. And I think we have responsibility to look at that. So yeah, if the school wants support, well, we'll get this together and we will charge you this for that service, because that seems to be the landscape out there. Would we ever put a foot in that, or do we still consistently offer free services to schools in a myriad of different ways and not income generate out of that?
So I might do that one last while it's in the front of my brain.
Okay.
So we do trade some of our services already, so including our educational psychology service has a traded element to it. I think there are opportunities for us to look at how we might grow that.
Yep.
It's really important that it's a high quality offer if we're going to trade it, because we would be in competition with, you know, other organisations that might offer similar, that academies would be able to choose from. There isn't just us to choose from, but please be assured that we do already trade. It has to be done in balance with what the universal offer is, that we believe that all children and young people need to be able to have access to through the work that we do with our schools. So there will always be things that we would advocate should be free at point of delivery for that reason, and then there will be other things that we think we could potentially perhaps trade more in. You know, so I would love us to be able to grow our traded offer in areas even more like our EP area. So that's that bit. In terms of going back to the questions around inconsistent school culture and how we support our schools, obviously I've given a couple of examples of that in a previous answer. But what I mentioned about the inclusion advisor role, for example, but what I haven't mentioned is our ordinarily available provision and graduated approach. We have one, most local authorities have one. We haven't done a huge amount of work around how that is lived yet. And that's our next stage, is to work with our schools and in particular our Senkos. We've got some fantastic Senkos out there who we think could work with us to really co-produce what's the toolkit, how does that actually get lived when we're talking about a different stage of the graduated approach. How does that get actually implemented in schools? And when we're talking about the ordinarily available provision, what do we really mean by that? Is that everything that schools have got to do? What's our ordinarily available provision that goes alongside that? How does that work with our early help system and all of us as early help partners? That schools, we need to make it easier for schools to be able to navigate all of that and be able to enact that every single day in their schools. And so our next piece of work around that ordinarily available provision and graduated approach is exactly that. And the other aspect of this is about lifting school leaders out of their roles in their schools and helping them to see themselves as system leaders across the whole BCP system. And so that's why we're going to be starting an education partnership board, and we're going to have really clear priorities which will be again co-created by the system and then delivered by the system. And I think that's a really exciting space for us to be in. And I think now more than ever, our schools want to be in that space with us, and they're really keen to lift themselves up in that way. And the conversations that we're having with them are actually really exciting conversations. So it makes me personally feel very hopeful.
So the thing we haven't mentioned yet, and I thought was quite central to a lot of this, is the inclusion fund and the use of that and how that, as it were, interacts with schools. And I just wondered if, you know, sort of where are we with it? Because I know it's starting, isn't it? Is that, you know, we are rolling it out, as it were, and we are starting that work. So where are we with some of those work streams? And it also feels like perhaps something that this committee might want to keep an eye on. I just wondered your thoughts on that.
So the inclusion fund was allocated from a surplus from the schools block of the dedicated schools grant, and working really closely with schools on what priorities would be delivered from that, because we couldn't deliver everything with the amount of money that was available. The three areas that were identified were inclusion advisors, growth of outreach support, and a rollout of a training offer into schools. And so we've done that piece of work to establish that those were the three things that we would go forward with. We're just at the point now where we're ready to go out for recruitment to the inclusion advisor roles, because obviously we had to create the job descriptions and put those through job evaluation. The outreach agreement is ready to go. And the bit that hasn't started yet is the training offer into schools. So that will start very, very soon. and then alongside that, we have the Send Improvement funding, which then takes us onto the next layer of support around good inclusive practice, being able to roll out the leadership program, focusing on reducing suspensions and exclusions in school, particularly of children with SEND. So I think it's quite an exciting space, but yes, we are still at the very beginnings of that. Thank you. David.
Thank you. On that inclusion, suspensions, exclusions for some pupils, EHCP pupils, on line 80 and 82 of the dashboard. It's got the December 24 data, then January, February, March, April is missing, and then May is saying it's available in July. Can I just check where that data is, and for the 86 and 87 as well? I presume that information is available, but it's just, is there any reason why it's not on here?
It would have come in for the term rather than for the month. So I think that's why it's not there. It is there now because obviously we have the full year's data now.
And in terms of going back to that, also that bit you touched upon around, you know, inclusion and schools, in terms of those, maybe the schools that are, how do I word this, are more exclude or suspend their students more than the others in the conurbation. Is there already work going on with those schools we identify, or is that something that's in progress? Where are we with identifying? I know it's easy to identify them because that information is available, and we can all see it. But yeah, is there current work going on with those schools in particular, or is that something that, as I say, is to come?
We work directly both with individual schools, but also with trusts, where we feel that that's what we need to do, having those conversations directly with the trust leaders. And then we will target support for particular schools or trusts where it's needed. So when we have the inclusion advisors, there will be even more ability to be able to do that targeted work, because that's exactly what they will be able to do. We will target schools for involvement in particular programs. So, for example, obviously the offer for the inclusion leadership course was open to all schools, but we also targeted certain schools that we felt it would be really beneficial for them to be part of it. So we're always looking at that data to target where we need to.
And is it fair to say on those schools that you target, what's the general response you get from those that you may have concerns about their comparative numbers?
I would say it's really positive. They, of course, want to tell us about what the challenges are for them, and they do see SEND sufficiency as one of those challenges. But they are also open to the conversation around what they might be able to learn or do differently. An example of that is where a school was targeted in particular in relation to repeat suspensions. This isn't SEND specifically, but repeat suspensions around children in care. And that school doesn't feature in the top anywhere anymore because of the work that they were open to doing with us on changing their practice. So I'm saying it's a positive direction.
So if I may come in, I think I'd want us to, the data that we receive and looking at the figures, its suspensions, etc. for EHCPs, it is about being curious. So for some of those schools where there might be higher, that's because they take a higher rate of, they're very inclusive. And so we have to really question, it's not always a negative. It could be that they do quite a lot of work, but they take a heavy load. So I just wanted to say that.
And I'll just reiterate that as well. It's not about targeting because the numbers are high. It's about, like you say, understanding that they may have those pressures that other schools don't have to deal with. So yeah, I would like to acknowledge that and understand that. That's really key. Thank you.
Yeah, it feels like there's a sort of an ecosystem that needs a bit more growing doesn't it? It's there, and it feels like lots of things are being planted, and we're waiting for them to fully sprout. I don't like to stretch in an too far, but okay. Do we have any more questions? Or oh, I'm so sorry, Peter.
Kind of interlinked with the inclusion one. Do you do any work about kind of equal access and different groups of people with SEND and what services they get? Is there an unequal service there, if you like? Is there a certain group? It's difficult to word, really. It's almost like there's a lot of different conditions that fall under SEND, and is there a kind of an equitable access to the services that we can offer and schools can offer? And if we don't know that figure or that number, is there any way that we could do that, or are we already doing it?
I don't I don't want to say an answer that I don't feel confident is the right one, and I don't think I do have the answer to that. I know where our growth areas of need are, and that therefore we're considering how our services can ensure that we match those growth areas of need, particularly in relation to social, emotional, mental health and autism spectrum condition. But I wouldn't be able to confidently say to you that I therefore know that we're giving equal access to all groups and all needs.
Is that something that we have? We know that, you just don't know it now, and we could get to Peter, or we could get to the committee, or is that something that perhaps we just don't know?
Can I explore with you exactly what you mean outside of here, so that I can be sure that I bring the right information back? Would that be all right?
Absolutely, because it's a layered question. So.
Yeah, and we've got Olivia coming in.
It's a quick, there probably isn't an answer for it, but we, with the discussion of the need for 800 new specialist places coming up, and we're still waiting for the DFE to get back to us on that place, and fingers crossed. If that doesn't come, do we have like a contingency? I know that's a huge question, but my concern is that we are on this trajectory, as is the rest of the country, and we are kind of sitting here waiting, and my worry is if that doesn't come to fruition, then where do we have any kind of contingency for that? Because as I am a teacher, I know the impact it's having on so many different people.
We are pursuing our options in relation to the reuse of the Parkfield site as we speak. So that is not reliant on the free school money coming down from central government. We can go ahead and do that work anyway, because we have a high needs capital allocation grant that we can allocate a proportion of the money to any works that might need to be done to make that school ready for being able to be a provision, and we're focusing on it being a social, emotional, mental health provision, most probably. So that's one of the areas. We are always exploring other options with our trusts in terms of spaces that they may feel that they have available. And we're always open to those conversations, and we regularly bring those suggestions and ideas to the Department for Education, so that because obviously we need to have their say so as well. So yes, there are those contingencies. I think the other thing that I would want to say, though, when we're talking about SEND sufficiency, is that we could have 1,600 places available, 2,000 places available. We will fill them over and over and over again if we don't also do the work on the early intervention and early support. So the two must go hand in hand. And obviously that figure that's in the paper is an ever-changing figure in terms of what the actual place need is at any one time. And our work developing our resourced provision within our mainstream schools is a really important part of our commitment to inclusion in mainstream settings. It's not about children who need a special school. If they need a special school, they need a special school. But there are also a cohort of children who, with something a little bit more additional and different, could be really, really successful in mainstream settings, and resource provision enables that. So our commitment to that is still really strong, and hopefully you could see that in the paper.
Thank you very much. I think that is all for the questions. As I said, we are asked to note this report at this point. And I don't think we've specifically identified an additional resource as such. I don't know if anyone has any recommendation they wish to firm up for the committee to consider at this stage. I'm looking around the room. I don't have that. So thank you very much indeed. That was, I mean, as I said at the beginning, paper was very, very full. It gave us a very good overview. And I think it almost gave us a difficulty of where to start to dive into. But thank you very much because we did discuss it very fully and very well in the end. Okay, so moving on, we now have, I think, Lisa is also, because we all like working very hard at 8:30 at night. Onto the alternative provision improvement plan. Over to you.
Thank you. So we have too many children and young people who are going into alternative provision, and we have too many children and young people who are staying too long in alternative provision. And so what this paper brings you is our outline for developing a 3-tier AP, that's alternative provision, a 3-tier AP model. That model focuses on much more outreach and early intervention and support at that early stage before a child even needs to go into AP. Then the opportunity for short-term turnaround placements at tier 2, and then at tier 3 making sure that if a young person does need to spend time in alternative provision, that there is a clear route out and on for them, either back into a mainstream setting, into a specialist setting, or into their post-16 provision, whatever that might look like. We're just bringing you this paper to have your support really for that option going forward in terms of developing that model.
Thank you. So I'm open to questions and comments from the committee. David, over to you.
Thank you, Lisa. Just around on number 20, the number of AP placements by national curriculum year. See it, year 7, 8 and 9, big increase, 10 and 11. You just talk me through what we're seeing there and why it's spiking at that point. I've made some of my own assumptions, but I'd be really keen to understand your view and sort of what your experiences of that, please.
Not an uncommon profile. I would say I think the bit that's perhaps slightly uncommon in that profile is the 113 at above year 14, where again that just demonstrates that we're leaving our young people in alternative provision for too long, when actually we have a really growing, wonderful, for example, supported internship programme. And we need to utilise programmes like that to make sure that those young people are able to access something really fantastic that will lead to meaningful employment for them at the end. But in terms of that profile that you're describing in 8, 9, 10, 11, those struggles that some of our young people are having in their secondary education with the curriculum and the restrictions around that the curriculum, some struggles with their mental health and well-being and emotionally based school avoidance. Those are the kinds of issues that lead to those young people then needing alternative provision. However, what we've also got to recognise in this profile is what we've just been speaking about, which is that self-sufficiency challenge that we have, because we also have young people who are in alternative provision while they're waiting for a specialist placement that isn't available for them at this time. Does that match with your supposition?
Yes, yes, to a degree. I think, yeah, I'll leave it there for the moment, but yeah, thank you.
Emily. Just to lead on from David's question a little bit, for the younger age learners there, what does that alternative provision look like for them? Because as I understand it, and please, I could play this completely wrong, a lot of it is online. What does it look like when the learners are younger, the alternative provision?
There are some therapeutic packages, so they might include some kind of mentoring support or actual therapeutic support. There is tutoring even at the younger ages, so we will have tutors that are going out to do that tutoring in the home or in set locations. And there are a number of alternative provisions, even at the younger age, that offer a bespoke curriculum to those young people.
And yeah, leading on from that, in the report it mentions that some of the alternative provision is unregistered. And I want to understand a little bit more about what that means and what checks and measures are in place to ensure it's good quality, it's the right thing for those young people, and also leading on from that, also that it's good value for money. I've got concerns that it's a very it's a seller's market, and I want to question how much we are having to pay what is being charged because there's no other choice, if that makes sense. So there's a few questions in there.
No, I can completely understand everything that you're saying, and I think that the ideal would be that every child would be in a registered provision. The unregistered market brings with it a greater variety in terms of options for families of what their child might need, which is, I guess, part of why there has been that growth. We do have checks in place for all of those provisions, and we have just created a new quality assurance framework that we're rolling out as a Dorset-wide quality assurance framework, because obviously both councils use often the same provisions, and we want to make sure there's a consistency across in terms of how we're quality assuring. And our framework that we're launching hopefully this side of Christmas is also a part of that. So there will be a process for any provision to apply to be on that framework. And there will be different lots on that framework for the different types of provision. So whether it's tutoring or therapeutic or whatever it might be, there'll be those different lots. And then our schools will be able to see these are the provisions that are on that framework and have been through all of these checks and balances to make sure that they're appropriate. And then obviously we also have the checks on the individual children and young people as well as the actual provision. So there's lots of different layers. In terms of the decision making about whether a provision is right for an individual child and cost effective for an individual child, we now have a more robust alternative provision panel in place that's multi-agency, that's making those decisions. I say it's more robust, it's in its early stages at the moment, and we know we've still got some more tweaking to make it absolutely right, but it's definitely more robust already. And then we can much better track and bring children back into that process more quickly and say, well, actually, we've paid for that for 3 months or 6 months. We want to see what impact that has had before we pay for anything further. And I think we're just becoming much, much sharper at those processes now.
So with regards to that tracking, is there now that was something that wasn't happening before, but now it is. So is that right? Am I right in thinking that? And is it an individual person's responsibility? Is it a team? What does that look like?
So we have an alternative provision team. We also have within the SEND team, because obviously a number of high proportion of these young people have a special educational needs. So we also have a pod within our SEND team that are allocated specifically to alternative provision. And we also have our multi-agency colleagues who are coming into that decision-making space with us so that we can make sure that we're doing, we're setting it out right with the partners from the start. Trying to think if I've covered everything you just asked me.
That was good. Thank you. I've got lots more questions, but I'll stop for now.
So it's Mark Saxby, Diocese representative. It was just regarding 26, and it relates to that really about is the welfare call around attendance. Is that challenging the AP provider to establish what the reasons for absence are? And I was just struck by the 50% attendance rate for AP providers in our area. It was startling, really. And then seeing the national at 41, we're putting all that energy into supporting these providers and the costs involved, and then we've only got 50% attendance.
That 50% was from our registered providers. The reason that we are using welfare call is to make sure that we can track the children, young people who are in alternative provision and aren't on a school roll. Because when they're on a school roll, the school is responsible for tracking their attendance. And so we have, there is that system in place, but there is that smaller group of young people who weren't being tracked, and welfare call do daily checks to make sure that those children are in school and to feed back to us if they're not. So it just makes it much easier for us to be able to see and track those children in a way that we weren't before. You mentioned the AP panel, and we also have the AP working group. I just wondered who's on those, and are there any counsellors on them? I've got no idea. So the AP panel is to make decisions about individual children. So requests will come into that panel for a child to have alternative provision, and the panel will make the decision as to whether that is an appropriate decision for that child to have AP or not. So schools are part of that panel. Obviously, local authority are part of that panel, health are part of that panel. And in terms of the alternative provision working group that is working up that 3-tier model, that is health colleagues, alternative provision colleagues, school colleagues, the college, the difference. I'm trying to do from memory who else is represented in there. Our parent carer forum. You said our counsellors.
I just wondered if, it may be completely inappropriate for them to be, but I just didn't know, so I thought I would ask.
No on both.
It's nice to be wanted. No, I'm joking.
Would somebody like to join the AP working group?
Only if it were appropriate. It's good though that we do have the parent carer forum on that working group. That is very good to hear. So thank you for that. I also have I hope this isn't a crass question, but I just wondered what the numbers were on, as it were, the different routes into AP in terms of, as it were, the people who've come via exclusion and the people who've come via EHCP, for example, if that's the right way of seeing it. I just wondered what sort of, the percentages, if you like. I've just got no idea. I was just trying to get an idea of it.
I haven't got that in my head, but we have done a lot of deep work on this, so that is something that I'm more than happy to provide.
Because there may be something under that we need to get to. So that's why I was interested. So it's good to know that you're working on that. And the other question on the sort of figures, if you like, is 81% have an EHCP. Is that in line, and I'm sorry if it was in the paper, but I haven't noted it. Is that in line with sort of national figures, or are we an outlier? Are we below, above?
It's not so much that we're an outlier in relation to them having an EHCP. That's not unusual. We're an outlier in terms of the large number of children who are in alternative provision in totality.
Thank you. I have another question, which is, I think it's point 32. I've written the number 32 next to it, so I'm hoping that's what that means. Where does the annual AP provider safeguarding and quality of education audit report to? Where does that information go? And any child feedback on that? Thank you.
So we haven't had the first audit through yet. It will initially come into the service and will report through our Education Quality and Performance Board. And then depending on what comes out of that will depend on where it needs to go next. So it may be that it needs to take a safeguarding route or another route depending on how that first one goes. So I'd be very happy to come back and let everybody know once we've done one.
It's a similar question I was going to ask, but you phrased it a lot better than I would.
I just have one more question. The implementation, sorry, I've had to write notes, so I'm just going to read them. The implementation of a 3-tier model of AP will require changes in practice and increased collaboration across schools, local authority, and wider education and health partners. And I just wondered, if we have it, what does it look like, that collaboration? That, is that already there? Is it, what was it, how is that forming?
Largely through what, until we realised that we didn't have counsellors in it, I would say a very well represented group on the AP working group, and the feedback loop in that from schools and other partners has been very positive. And then in our head teachers forum, which is next week, I think, from memory, we're then bringing that through to all of the head teachers, so that we can get their feedback on the progress we've made so far. And we're also we've also invited a trust from outside of BCP to talk with our head teachers about their work in relation to alternative provision and how not only they've changed their practice with children, but they've also reduced their costs as a consequence, which is a nice message. And then the third route through is that there is now a termly meeting with all trust CEOs, and the first one of those is happening in October. And so it will travel through that route as well in terms of that really good engagement with all of the school and trust partners. But the wider partners are all represented in that AP working group.
Peter, and then I don't have any other indications, so I'm hoping that might be the last question.
Okay, thank you. I'm just looking at next steps, so it's really good that the Children's Rights and Engagement team are kind of working with you. But it's like I'm interested when you say we are developing a quality assurance process to monitor the reviews of individual children and young people accessing AP placement. So how does that manifest itself, the monitoring process?
So
Please.
the actual audit has been written already and is ready to go, and then there will be visits that take place out to the alternative provision providers to see what the child is receiving, what does their Tuesday at 2 o'clock look like, are their curriculum needs being met, what does their attendance look like, etc. So so it's through obviously a certain amount of desktop activity, but actual visits to the providers as well.
And how does the young people's views meld into that, and the families? Is that part of the same process, hopefully?
It is, yes.
Thank you.
Right. I think that is all we have on that. So thank you very much. As you will have all seen, we had the recommendation that we note the 3 elements, the progress made in developing a 3-tier model of AP in line with national guidance and local strategic priorities, the preferred model and the rationale for its selection as set out in the options appraisal, and the next steps in implementation, including further stakeholder engagement, development of service specifications and alignment with wider SEND and inclusion reforms. And I just wonder, I mean, do we want to note that, or do we even want to support it, as it were? Yeah, is that all right? Okay, thank you. Thank you very much. I realise, I'm really sorry to do this, but on the previous item, I did actually just want to propose the monitoring of the Inclusion Fund progress to be added to the work plan. You know, the Inclusion Fund, this 1.3 million it ended up being, didn't it? 1.2 million, I apologise. And I just wondered, I suppose I'd quickly ask you, Lisa, if you think that would be useful in, you know, if that's something that we could monitor the progress of it. I just think it seems to me to be a linchpin of how the council wants to tackle some of the you know, the issues around our DSG overspend and what have you. So would that be an appropriate way of looking at it?
Yes, absolutely.
So in which case, I'd just like to ask the committee if we could add to the work plan, or we'll see exactly how we administer this, but perhaps a regular check-in on the progress of the Inclusion Fund, the work being done through it. Thank you. Thank you. And I'm so sorry I didn't round that off properly at the time. That takes us mercifully to the items for information, and these will not be presented unless, but I do ask if anybody has any things that they would like to raise on them. No, thank you very much. In which case we then come to the portfolio holders update. Richard, over to you.
Yeah, thank you very much. Okay, the first thing, still no SEND inspection. You know, if I was a gambling man, and I'm not, I would have lost a lot of money on this by now. But that was how I was going to leave it. But what I would remind everybody, just coming on with some of the questioning that's happening early on in the meeting, don't forget the SEND inspection is a joint Ofsted CQC inspection. And therefore it is, you know, both of the parties is health and us. Just picking up on one of the questions that you asked, Chair, about mental health and special education needs affecting mental health. Of course, it also works the other way round, that mental health issues do very much affect education and learning and can produce special needs, if you see what I mean. So it is a circular thing. And just adding on to that, what wasn't on mine, but I've just added on, the head teachers, well, actually it's called the Schools Forum, is on the 29th. And I will be there, because I always am, if I can be. It's always interesting to promote what's going on and see how the schools are responding and learning. Officers have met with the DFE to look at our progress pertaining to the delivery of the Families First programme, and they were happy with how things are going. We have a range of partners to support this work. We have a new quality assurance board for children's social care, replacing the improvement board. A lot of work has been done to ensure the right people are at the board and develop this governance in terms and its terms of reference. I'm attending these meetings and continue to attend SEND Improvement Board, which is also being updated. Just remind people there's a safeguarding training for all councillors on the 28th of October. It's down as a mandatory training. I would encourage all councillors here, because I know it's the sort of thing that you will be really keen on. But if you could highlight its importance to members of your group and other councillors that you talk to, because as you can imagine, it is really important that we all understand safeguarding, because we often get involved in things as councillors, and knowing what the right processes are and how to deal with things the correct way is so important. As you all know, we have a new chief executive. I met him along with the rest of the cabinet on his first day, and I ensure that children were highlighted in our discussions. There's support in place to help him understand all things children related. Adrian has met with social workers and educational staff, and I will ensure that we have another longer meeting soon. I did make sure to point out to him at our meeting when he did say he got 2 children. I said, no, you haven't. You have now just gained several hundred more. So I have done that. Exam results recently released August the 14th for AS and T levels, and the 21st for GCSEs. I sent out my congratulations via the media. My gut feeling is that the schools have done well by our children again. Our schools do tend to be good at this sort of thing. But remember that these are provisional results, and the DfE validated data isn't available yet. If the committee is interested, if you want to look more closely, normally by about 26th of January meeting, they will be available. Just following on with something that was debated at council, the smartphone free childhood. There is an event on the 7th of October in the evening, and all schools have been notified and invited to attend by the Head Teachers Network. And finally, BCP Star Awards for the 16 to 25-year-old care experienced young people is on Saturday the 7th of November at the Bournemouth Life Centre. I know several of you have been into that sort of thing in the past, so if you're interested, they're always good events. Actually, the last year's one, I took away a lot of the competition thing. There's always things going on, and we do find out how competitive our officers are when that sort of thing happens. I will say no more, but if you come along, be prepared for a fight.
Thank you, Richard. I don't think I've had an invitation to that yet, but perhaps they haven't come out yet, the Star Awards, but it could be. Do we have any questions for Richard? No, okay. Thank you. So thank you very much. In that case, we move on to the work plan. And there's just something I need to discuss briefly, don't worry. So the committee has a hold for a budget item at the November meeting. I've had 2 suggested topics for this, and that's the value for money of our alternative provision, as mentioned earlier, and the costs associated with SEND tribunals, as also mentioned earlier. However, I was reflecting on this, and this is only a proposal. It occurred to me that these are actually essentially, as it were, symptoms or aspects of inclusion as an overall piece, and so the inclusion and the send overspend, and that this could be the potential theme for this budget work. And a budget report is scheduled for the meeting, and the committee scrutiny will be shaped around this with a Chloe to be developed. So what we will need to work on, and I can send something out by email afterwards, are the specific questions that will form the Chloe, and subject to formulating that, a briefing will be arranged with officers to explore the topic further and gather the information that we will need in order to create the report for the November meeting. Given the lateness of the hour, I mean, we could have the discussion now, but I'm thinking nobody wants to do that, and I'm not sure it would be the best discussion that we've ever had after 3 hours of meeting. So I'm going to propose that I try to work up those questions, work up the Chloe document, circulate to the committee, and then take comments back and then share with children's when we've done that. And I can do that pretty immediately, but fairly quickly. Is that okay? Everyone agree? Yeah. Thank you very much. And then I just also wanted to mention that there was a little bit of a hiccup. So we had 2 cabinet reports, the home to school transport and special school funding review, and they're due to go to cabinet in October. And these will be shared with the committee once published, and members are invited to send any comments to me or directly to Democratic Services ahead of the cabinet meeting, or they can go to cabinet themselves so they can be raised as appropriate. So the fact that it hasn't come here first does not curtail our ability to comment on the Cabinet in any way. I've also requested that a short update be given at the November meeting to outline what the reports cover and the outcome of the Cabinet's consideration, in case you're not able to attend or catch that. Both items will also be included on the agenda as information only for committee awareness to ensure members are kept informed of key developments in these areas. It may also be that updates coming from these reports will be substantive items for further scrutiny if the committee so wishes. Okay, so those reports will be covered by this committee. Are there any questions on any of that from the committee? And any items requested to be considered at the next meeting? Oh yes, and does anybody have any items that they wish to place on the forward plan to be considered at the next meeting? Because obviously we would have to ratify those. If you have anything, please just let me know or put in a scrutiny request form. In that case, that's actually the longest meeting we've ever had, and I generally aim for 2 to 2.5 hours, and I can only apologise because I think you should have a chair that can keep hold of a meeting. However, I know it's tragic, isn't it? However, I think that we had some really, really meaty items, and I think we had excellent debate. So I want to thank you all for your attention and for being here. Thank you to the officers. It's been a long day for everybody. So I wish you all good night, and good night to anybody still online.